Jacob is very outgoing at home, but still shy in front of people. He still has trouble talking in front of people when they ask him questions, but he is like a typical normal kid now. He gets to do and play like every other kid. Get him, tag him out.
He's a very resilient kid. If he has to go to the hospital or if he has to take medicine, or he just kind of goes with the flow because of all that he's been through.
When Jacob was 3, he was walking in the living room and he fell and started crying and said his legs hurt. So it was almost bedtime, so we just said, well, just go to bed. And when he woke up in the morning, he was crying that he couldn't walk. A couple days later, he fell and said the other leg was hurting, and so we brought him to the pediatrician, and the pediatrician took one look at him and said, Jacob, what's the matter? You're so pale. And I said, we're not sick. You know, we have a boo-boo.
He was diagnosed with pre-B acute lymphoblastic leukemia.
It was unbelievable. I almost collapsed and screamed and didn't want to believe it was true. No one wants to think that, you know, first not knowing anything beforehand, you think your child could die. It's the worst feeling in the world.
Right from the very beginning, we got this sense that everyone was telling us and treating it like he was going to be fine.
We have both established investigators as well as a new group of investigators which are at the beginning of their careers, which is the most promising part of discovery. We also have a graduate school which feeds into the next generation of scientists which work in our cancer center. And we also have clinicians, both residents and fellows, as well as junior faculty, which can come through the labs and apply their clinical knowledge to a basic research question, and then bring that knowledge and way of thinking back to the patients.
Everybody at UMass is unbelievably wonderful. He just asked me the other day, am I going to get a fever? Can I go to the hospital? He used to look forward to going to the hospital because at UMass they made him feel like out of this world special. Now he's played basketball, he's gotten trophies, and has played baseball for the last 2 years, and it's all because of everybody at UMass. I don't know if it would have turned out to be the same had we gone elsewhere.
Jake's an amazing kid. Just watching him go through the three and a half years or so of treatment, to see him now, it really makes you feel good.